Good morning, everybody. I'm delighted to be here today. We're just going to let people join, quite a lot of numbers to join us, and then we'll get started very shortly. And Ab- AbbVie we're very grateful to AbbVie for providing arms and funding for this project. But to be clear, that AbbVie have had no influence in the project or anything that we have done in preparing for this webinar this morning. So that's fantastic. I'm just going to quickly ask my guests here today to just say hello, and then we'll come back to you again to do your introductions. So Simon.
Hi.
And Gillian. You're on mute, Gillian.
I'm so sorry. Hi, I'm Gillian.
Don't worry about that at all. And Sarah.
Hi, I'm Sarah. Great to be here.
And Aaron.
Hi, I'm Aaron.
Great. So welcome everyone to this webinar about living with long-term health conditions and the untold stories. Obviously, you've just met our very special guests who have joined us, who experience these kinds of ongoing illnesses or disabilities each and every day. Unfortunately, we were meant to have another panelist with us today called Shakila, and she's had to give her last minute apologies as she's in hospital. And she's really disappointed not to be here because she really wanted to tell her story. So on behalf of all of us, she said she was going to try and listen in. And we wish her all the best and hope that she gets better very, very soon. But what we will do is try and do a blog with her shortly because she really wants to tell that story. Now, we're holding this webinar following the research from Future Health, which reveals the impact of long-term conditions and multiple long-term conditions, which was commissioned by AbbVie, which found that over 56% of adults in England have a long-term condition. Whilst medical professionals strive to understand and treat these conditions, hearing real-life stories and accounts from those directly impacted is invaluable. Our guests today will share their personal stories and situations. They'll discuss the practical realities, dealing with symptoms, treatment and lifestyle adjustments, but also the emotional impacts, the feelings involved, the effects on relationships and daily living. The challenges of managing long-term conditions and multiple long-term conditions is resulting in patients receiving a mixed experience of care. Our recent data found that only a third of patients said their care had been well coordinated, with a third disagreeing. 40% felt that they had been kept informed about what was happening to their care. A third did not. 2 in 3 patients told us that they struggled to access at least one of the services they needed. By truly listening, we can better comprehend the challenges faced by people. And by listening, we can really do things that will help make a difference to enable people to live the best possible life that they can do. So our aim from this webinar is to raise awareness, promote understanding, and explore ways to improve life for anyone dealing with a long-term condition. So we're going to begin now, and you're not going to hear from me much, and I am going to ask a lot of questions in a while, but what I want to hear is from you four. So Simon, I'm going to hand over to you first.
Thank you. Well, I'm Simon. I'm 50 years old. I'm from Barnsley. It feels like a real long, reeling off a shopping list with the things I've got wrong with me. I'm a type 1 diabetic. I've got proliferative diabetic retinopathy, so I'm sight impaired. I've got diabetic neuropathy. I've got anemia. I've got chronic kidney disease. I've got recurrent depression and generalized anxiety disorder. So it's like a lot to sort of put up with. The main one I consider is obviously what I have to deal with day to day, mainly is my type 1 diabetes. And for that one, I cannot get access to a face-to-face appointment. It's 5 years since I've had one. Yes, I get seen at my doctor's, but I'm not obviously getting access there to a diabetes specialist. So there's a real lack of support, and it just feels you've been left out on your own. But I do manage to get on with it. But to say it's, you know, that it's not a struggle would be a lie. It would just be nice to have that little bit of support network there, which I just feel I'm not getting. Another barrier I came across is I was once woke up, was in the house on my own, and I was in a major hypo, and I was very confused. I tried to get up, and my legs just kept giving way. I had to crawl across the floor to go, and then try and lift myself up to get some jelly babies, and then I was going to just go back to sleep without even eating them to get my blood sugars back up. So that would have been a bit of a catastrophe. So I asked at the hospital when I was seeing them at the time if I could get a continuous glucose monitor. And even after I had had that incident, I was told there was no funding available to do it. And it took another 2 years of fighting to be able to get the early alarm monitoring, which is going to alert me to hypos of which I'm really not aware of. It feels, yeah, you sometimes feel like you're whinging, but you've got to try and get these points across to let people know how serious, you know, these things and life-threatening sometimes these things can be. Like all the offshoots of what is wrong with me, that yeah, because I didn't look after myself when I was younger, but feel the care I get at the hospital for my eyes is inadequate. You're just, it's like a cattle market. It's just, they'll do your pre-checks, they'll send you in, doctor looks in your eyes, yeah, I'll see you in a few months. No chance to sit down and ask any questions. Yet with recent reports that I got a membrane over my eye, which could be potentially bringing further complications with my eyes and on top of what I've already got. So yeah, I'm just feeling like, yeah, from sight impairment, there's no help, not a lot of help there. I've got to just write all this down because there's just so much. Yeah, I sort of like jumping through hoops as well. If I've got any problems with my feet, I cannot access like the feet specialist, podiatry straight away. I have to go through my doctor, which can take time to get a phone call, and then you've got to, you know, wait to get your appointment as well after you spoke to your doctor. So it's really frustrating when you're trying to access the needs that you're looking for. The other things I've got to remember, I can't work anymore, and that it's a real pressure on mental health, suffering with my depression and the anxiety disorder. You feel sort of worthless. You feel like you're not contributing anymore. It feels like you've lost your dreams or all the things that you maybe wanted to do in your life. And it just feels like you've been left behind, really. It feels like there's nobody sort of there. I'm not going to go down the route of how dark it's got with my depression, just out of respect to anybody else who may have suffered with that. But I have to believe that there's better days ahead, and that's the only single factor that keeps me driving on and going forward, is that you've got to hope that things can get better at some point. And I think that is what I wanted to say. Otherwise, I'd have been here all day.
Simon, thank you. Thank you so much for sharing the story. I'm so sorry that you've been left in a position where you feel worthless and left behind, and you should feel like that. And thank you for sharing that story with us. And we got down to come back and ask you some questions, but what's coming across really there is that you're not feeling listened to, and that lack of communication that's happening, and that having not been able to get you those kind of secondary care services that you need without having to go through first to primary care. Um, can I come over to Sarah?
Was that me, Rachel?
Yes.
Great. So I'm Sarah, I'm 24 and I'm living in Oxford. And I live with severe asthma and chronic urticaria. And it took me a long time to get my severe asthma diagnosis. So I was diagnosed with asthma when I was 1, after being in and out of hospital with breathing difficulties. But I didn't get my severe asthma diagnosis until actually just last year, even though I'd been on high dose steroids for a long time. And I now require biologic injections to treat my asthma. So I take injections every month. And I've had a real mixed bag with my healthcare experiences. So when I lived in a previous town before I moved to Oxford, I had some awful experiences with doctors, really. So I had an admission to hospital where I had a doctor kind of not believe that I was as ill as I was, and kind of started to question kind of whether I was as ill as I was. And it was quite nice to get those objective test results back to prove that I was really quite ill. So blood test results, things, and kind of spirometry, which is test your lung function. And that kind of proves how ill you really are. And I had to take my dad along to one of my appointments because I had an old male doctor who was quite dismissive of me as a young female patient. And I had to take my dad along to the appointment to kind of advocate on my behalf because he listened much more to an older man than he would to me, who was the patient. I was on high dose steroids for quite a long time, and they have really awful side effects. So I was on kind of 40, 50 milligrams of prednisolone, and they affect my blood sugars. So I was getting quite kind of spiky blood sugars, which I'm not diabetic, but a lot of my blood sugar was affected. It was also affecting my mood, so they made me really depressed, especially in the evenings when the steroid dose would wear off. And yeah, I gained a lot of weight as well. So really just an awful experience on steroids. When I moved to Oxford, I gained a really good specialist team. And they've been wonderful, actually. So they got me onto my injections, which meant that I can come off the high dose steroids. I haven't been in hospital now for 2.5 years with my asthma, which is frankly incredible. So I'm really grateful to my current team, especially my nurse who kind of does my injections on a monthly basis. She's got to know me really well and kind of supports me really well. So I'm very grateful to her for that. I think that's all I wanted to say at this point.
Brilliant. Thank you so much, Sarah. I turned off my camera because Zoom does seem to be creating some problems for us right now. People are struggling to listen and to hear across the board in the chat. So hopefully it'll settle down. Aaron, can I come to you now?
Hiya, my name's Aaron. I'm 29 years old and I've had severe respiratory problems from from birth, really. So it's meant I've had a lot of intervention in hospitals. If I wasn't in hospital pretty much every week growing up, then I'd be stuck at home wheezing. So I had quite an isolated time growing up. But there was kind of no real about why I was having these life-threatening asthma attacks. It was diagnosed as brittle asthma when I was a child, and I was ventilated for it as well, which was quite scary. And it wasn't until around 2022, so only really about 2 years ago, that I'd reached all of the maximum I was over the prescribing guidelines, and I was just constantly on high doses of steroids, like Sarah was, and the side effects of these are just probably the most difficult part of managing all of this with and in trying to get doctors to understand the side effects of these medications is so um it wasn't until I went to the Brompton. I was referred to the Brompton after uh it just became unmanageable from the respiratory specialist at my general hospital, and they prescribed me biologic injections, um, which didn't work, and I was then being admitted to hospital pretty much every week. I'd be stuck in wards for weeks. I ended up being admitted to intensive care back to back. Sometimes I'd be discharged for a week and then end up back in intensive care again. All the time that they would be measuring my eosinophil count, which the biologics are supposed to suppress, and my eosinophil count was just climbing. So the biologics were having a paradoxical effect, and despite all of the the Brompton being aware of this, they just kept injecting me with it, which then gave me eosinophilic pneumonia and my lung collapsed. And it wasn't until February this year that they finally changed me onto a new biologic. But since being on the biologics, it's like nobody knows who takes the lead in my care anymore. As soon as you're referred to a specialist, the specialist team then kind of get the buck passed to them a little bit, and they pass the buck back just as quickly. So nobody knows who's in charge of my care anymore. I don't know who to talk to when I need adjustments to my medication, or if I'm going downhill again. A couple of weeks ago, I was getting very ill again, who immediately said, "Oh, you've got to get in contact with the Brompton, get in contact with the Brompton." They say, "Get in contact with your GP." I just go around in circles until I end up in resus, trying to get any medications prescribed to prevent it getting to the severity of ending up in resus and then intensive care again is impossible. I just spend my life constantly going between medical professionals until I burn out and end up in intensive care. So I've been out of hospital for 2 weeks now, and I'm already back on steroids again. And it's just going to be another cycle of waiting until I end up back in intensive care again, which is no life really anymore. The impact it's had on my mental health has been terrible. The side effects of the prednisolone in particular, you feel like you're wired all the time. Sometimes it gets to a stage of mania. I spend weeks at a time not sleeping, and until I become quite delirious. Last year it got just unbearable. And after weeks of not sleeping, the best that my GP could suggest, because they don't really like to treat insomnia with short sleeping pills anymore. The best that they could give me was an antihistamine. So trying to get to sleep wired on prednisolone whilst unable to breathe, and quite often having quite traumatic nightmares and flashbacks of intensive care experiences whilst trying to get to sleep on an antihistamine, and still not being referred to mental health services for any type of support either, being diagnosed with a physical condition, and they don't really think about the mental health impacts. They just think, we'll get your physical health better and everything else will get better. But the reality is of when you're not getting better and you've got a long-term health condition, is that you just got to kind of manage it by yourself. So I've got the support of my parents, so I had to move back into their house at the end of last summer to live by myself anymore. So I've got the support of my parents, but they don't want to hear about the horrible things I'm thinking. So Yeah, that's my experience. Just constantly being passed around with no kind of lead in the care. Um, no end point. That's the most difficult point. There's no end point to this for me. That's it. So
Aaron, um, and Sarah and Simon so far, I'm lost for words about what you're experiencing. Again, thank you so much. We will come back. I will come back to you. Questions. I'm going to come over to Gillian now, and Gillian's going to tell us a little bit about her story.
Yeah. Hi, I'm Jen. Mine's going to be, I think, slightly different, really. I live in Birmingham, and I have long-term conditions, and I have a number of disabilities. So I'm not going to bore you forever, but I will tell you a few: diabetes, high blood pressure, physical disability, autism, asthma, hay fever. And yeah, high blood pressure. So I'm going to talk about as well some of the impacts that impacts me, and some of the things that I have to deal with on a day-to-day basis. So on some of the things that impact on my health is I deal with hate crime on a regular basis. I complained, so I'm also dealing with like I'm in social housing, so all my repairs stopped because I complained. Apparently, I shouldn't talk or answer back, as they say, and they don't believe in autism or dyslexia. So I'm being denied having information sent out to me in a format that I understand. Apparently, they get to control what I do. So they turn up at my house whenever they like. And it's not really nice, really, because that impacts on my mental health. And I'm trying to better myself. So I'm self employed and doing a part time degree and having meetings online. And people are constantly turning up at my door in the middle of a meeting, and it's embarrassing. And I'm losing work. And this impacts severely on me financially, and it also impacts on my life because work's not being done. And these are just, to me, simple things that people can work with. You just need to communicate with the people, and it's, to me, it's quite simple. And I just think it's wrong, really. I think people should have a voice. Also, my care package was stopped during lockdown when a number of my family members died, including my mum. When I was at the lowest point in my life, um, certain individuals thought it was okay to stop the package, and it forced me to be self-employed and to be basically begging to get people to assist me in my day-to-day living. And also I had OT came round and a number of recommendations, and everything was authorized. And because I've been told I've got too much to say for myself, then that work's been put on hold, and nothing's going to happen until they say I listen to basically what they have to say. And I think I'm an individual, I'm independent. People, disabled people do want to work. People with long-term conditions, we just need support. I need support. I can only really speak to myself. And I think if there wasn't so much barriers in place, then I feel that more people would be independent and get to that point in their life where they can be self-sufficient like myself, but it is difficult and it's not easy. And if someone was to say to me, should they do this? I'd say absolutely not. Absolutely not, because it's where I would say it's hell. It's not nice. There's no support there for you, and it impacts on your health more. Whereas I feel it doesn't really need to. And I think one of the main issues that need to be looked at apart from saying the social model of health this, the social model of health that, why not just look at housing, just concentrate and look at housing as a whole and find out how this is impacting, because this has a huge impact on people's lives, especially with a long-term condition. There's so many things that you have to rely on in order to get that support to continue with your day-to-day living. And I think this area needs to be looked at because it affects a lot of people. And I can go on and on. I don't know what I've said and what I haven't said, but I'm happy to share more. Later. Yeah, that's me.
Gillian, that was brilliant. Thank you so much. I know that all of you, but specifically you, Gillian, were feeling very nervous about starting telling your story there, and you really got it across. I'm going to ask each of you a question right now, because you talk about the barriers and being self-sufficient. What could be different for you in terms of your care that would help you, or live independently again, Sarah, all the things you've been saying? What do you believe could be different? I'm going to come to Sarah first.
Yeah, I think for me, so my current care is really good, but I think the waiting time to get proper specialist care could be reduced. So I was under a specialist previously, but I wasn't able to access biologic injections under them, partly because they didn't quite believe me, but partly because of the waiting time for biologics. Whereas when I moved to Oxford, I got biologics within 4 weeks of my first appointment, which was really incredible. So I think waiting times to get specialist therapies and treatments should be reduced. And also a sense of believing patients as well. So when patients come to you and say, this is having a severe impact on my daily life, I'm having to take these steroids, I'm in and out of hospital a lot, I can't study, I can't work as well as I want to. Doctors and consultants, especially kind of high-level consultants, believing you. And sort of recognizing that day-to-day impact, because they only see you for 20 minutes, half an hour in an appointment. And they might see you when you come in for an admission, but other than that, they don't see the day-to-day impacts. They just kind of see you for that short amount of time, and they don't kind of see that day-to-day impact. So it would be nice for them to believe you when you explain the day-to-day impacts that it has on you.
And Sarah, I'm going to come to the others, but you made, you said you wanted the healthcare professionals to believe you. Do you believe you believe that they don't believe you?
So my current team do. They've been wonderful, but my previous team didn't believe me all the time. They would question my when I expressed the impact it was having on my day-to-day life, they would question that, despite the objective test results, which proved that I had inflammation in my lungs. They wouldn't believe the extent of the impact it was having on my studying. So I was doing a degree at the time, and on my social life as well, kind of having to stay at home and get good quality sleep and rest, because I didn't have kind of the stamina to keep up with my friends of the same age, at 2021. I just didn't have that same level of stamina as other people. So it was really impacting my social life as well as kind of my academics. And they didn't quite believe that. They didn't quite kind of understand the impact it had. I think they were slightly out of touch with kind of young people's lives and didn't kind of realize the extent of the impact.
But they should. As a 2021-year-old, having a social life is part of living your life to the full and being able to do your degree. Thank you. I'm going to come over to Aaron now. What do you believe, Barry? What could make it better for you?
I think so. I saw somebody in the chat talk about the type of care I've been receiving is exactly what it feels like, to be honest. I think one of the main things that would be a massive game changer for me is knowing who is taking the lead in my care and knowing who my first port of call is, because the people that we would typically associate with being the first port of call, such as GPs or people like clinical. Now, my experience has been that every time I approach one of these people to get support, they'll pass the buck. I know that in other services, such as in child services or even profound learning disability services, there's the role of care coordinators. In a role like this, for people with long-term illnesses, who are under multidisciplinary teams, having somebody kind of take the lead and tie all of those teams together would be really important. I'm trying to, an example of kind of not really knowing who kind of has a care plan for me, or knows my condition best, or even knows my symptoms best, is I do. So recently I've been going through the application for benefits, because I'm not able to work anymore. And there's a question on it that asks which medical professional knows the most about you, and they will be the person that is pretty much going to be okaying your, kind of your story, so to speak. I don't know who to put down, because all of the people involved in my care know my symptoms, they know the severity of it, but nobody knows the individual parts of it other than specific teams, and none of them talk to each other. And trying to get them to talk to each other is impossible. Trying to get them to talk to me is even more impossible. So I don't know who I would put down. So the role of the care coordinator, or the official role, even the official title, just knowing who should be in charge of my care would be important, because I think it should be the clinical nurse specialists in the specialist team, but they seem to think it should be my GP. My GP seems to think it should be the biologic professor, who I've only met once. They think it should be the respiratory consultant, who I've only ever spoken to on the phone. The nurse specialists, they only ever see me when I'm admitted to hospital, or once every 3 months in the community, which I'm never in the community every 3 months. I'm always admitted to the hospital. So then they're only ever dealing with the acute problem. They're not dealing with the day-to-day kind of symptoms of it. So I don't know who I'm meant to talk to. And the people who I do talk to, I don't know who I'm supposed to talk to either. Care coordinator, that's my answer.
I'm going to come back and ask more about care coordinators, Aaron. And I'm finding myself getting extremely angry listening to the lack of coordinated care and nobody having ownership, and what an easy answer and solution would be. Gillian, I'm going to come to you. Well, you talked a lot about housing, and we've talked about that in our general election manifesto as well, which is about the cross departments working together to look at the health of the nation. What would make things better for you?
Well, mine's quite simple, really, but I think it's going to be difficult for some. Aaron hit it on the nail. The two things I feel that would just hit it on the nail for me, and I know it's going to be a very, very difficult post for some people, is someone that cares. And with care, I mean good manners that goes with it. Equally, I'll reciprocate the same back. And someone who's able to coordinate. So you can put the two together and you can call it a care coordinator. I think one person that actually knows what they're doing, and that person cares for the individual they're dealing with. So the post would be a care coordinator. That's what I feel would be benefit to me, because I think the simple things in life are free, doesn't cost much, and you don't need to take anything. It's just simple things in life, good manners, tick up the box, no mental illness, but that's what impacts on it. just someone that's there to listen.
Thank you, Gillian. And it is the simple things in life, and you're completely right, of treating people with dignity and respect. Simon, I'm going to come to you now. So what would make things better for you?
It would have to be mental health care. Couple of examples is when I've been to a doctor's struggling with a depression, and I was sent out of the surgery with not even a prescription because I wasn't looking after my diabetes. So I was sobbing when I came out. My wife got me another appointment. I saw somebody the next day and got some help with the tablets. Current doctors I'm in, I've been sent out before saying, well, there's nothing I can do here. And I'm sort of, I'm under talking therapies at the moment, and it's like managing depression. And she's suddenly decided to tell me, like 6 sessions in, that, oh well, you've got really bad depression, so this is not helping you. But we'll carry on with it anyway. I'm having to fight. I've had an assessment for ADHD that came back as negative, but they did a very thorough check while I was there. I wanted to be checking out for 2 other conditions. It took 2 years to get that assessment, and now I'm sort of like, it's almost like you're starting again, waiting to see somebody who can do the diagnosis on these potential 2 conditions that they've mentioned in the report. It just feels like, oh, people aren't talking to each other. My doctor hasn't got the report. I had to show it to him by hand. So then my doctor's always running around doing everything he can for me, but he's very limited on what he can do, and the difference of proper mental health support for me would just, that's low to me.
Thank you, Simon. And it it feels with each of your experiences that they're not looking at the whole person and giving what's called that holistic approach to it. Do you think, we know the frontline healthcare staff work really, really hard. But obviously something isn't right with the care that you're getting. Somebody in the chat box was asking a question about, is this because there's a lack of, the staff numbers aren't as high as maybe we need them to be? Or is this culture? Is this the way the system is working? Does anyone have a view?
Yeah, sorry. I would say it's up to the individual organization and the leadership, because to me, different people receive different care, and I don't understand why different people receive different levels of care when all the care should be more or less the same. Do you know what I mean? Not individual care, but what I'm saying is, if the level of care I'm receiving and the level of care somebody in another area is receiving, like a friend of mine, is different, and the difference, I don't know what is it, because that person doesn't talk and I talk, or I'm able to speak up for myself. To me, that's wrong. You encourage people to go back into education and be self-sufficient. So then when you do that, the gladiators come and the barriers start, and the obstacles start, and you can't go round one to the other. And I think it's wrong, really. Whereas to me, you should be supporting every individual, whether they work or whether they don't work, whether they're in education or not. People, that support package should be there. And I think if one person knew what everything was happening, then they can just talk to everybody else. But there's too many pots in the pie.
Sarah, Aaron, what do you think?
So I got a slightly different take on it. So before my condition unmanageable outside of being admitted to the hospital, I was working for the NHS and I was working with a specialist nursing team. And my experience of working within the NHS was a real eye opener as to why I was getting the type of care that I was getting. And one of the staffing is a massive issue. There's no argument about that. The workload of that staff have got now, of the patient ratio to one member of staff is absolutely ridiculous. Before I started a secondment with a specialist team, I was working on a high dependency ward of 28 patients, and despite the staffing ratios, there are legal guidelines, but these are never met. My patient ratio would be me, one member of staff, and I would have 28 patients to myself. Which is unmanageable. You can't meet the needs of every single patient, even basic needs at that point. So it was quite harrowing to witness it from that side. And then when I started my secondment with a specialist team, your patient ratio massively, because you are working with a specific type of patient with a specific type of need usually. And the problem that I noticed more so when you get down to working in specialist roles, is seem to be a real lack of empathy. It starts to become the norm to you. You start to become very deconditioned to other people's struggle, is what I noticed when talking to some of the nurses that I was working with, the way that they would talk about quite traumatic patient experiences. It was like flippant conversation. It was just casual. So I think a lack of care. People that work in NHS don't care, because there are definitely lots of people that do care. But I think people become bogged down with the workload, and that's what leads them to not care. That's what I noticed anyway.
Thank you, Aaron. And Simon, what do you
A
have
few
you
things.
oh,
What was that? Sorry.
no, that's okay. You started talking, so I stopped talking. So I thought if you just want to let us know how you feel about the kind of culture, staffing.
Just the care received. Sometimes you can't fault it. It's you feel that everybody is trying to help you, but you sometimes feel, particularly sort of the mental health ways, it's, I don't know if it's the number of staff or if it's the funding, but you do get across the different conditions I've got that people are pulling in to help you and get you the help that you require, but it just seems to be falling short. I can't even make an excuse for the diabetes team at the hospital. I've not had a face-to-face for 5 years because they have people up there for dietary conditions on the same ward. So you can't say it's because a diabetic might catch COVID or something like that and still be using that as a reason why we cannot go face to face. So that I've got a real problem with that sort of care. But the rest, I just feel it's funding or staffing levels, and I really do feel that people are pulling in a way to help me to really try and get me the care they need, although not always managing to do that.
Thank you, Aaron. I have so many questions. And there's so much I want to say to you because I I just really feel for the experiences that you're telling us about. And we are coming to a general election, and we are talking to policymakers, and we are talking to politicians, and we've written and we spoke to a lot of them about this webinar, and some people couldn't attend, and they want a copy of the webinar briefing and the recording. So when and those listening now and those who will listen to this webinar briefing, what is the one thing you would say to them that would make a difference to your life? Simon, I'm going to come to you first.
Wow, that's a good question. I would potentially, if I'm thinking like of me local MP, I want to just like sit down and have a chat and, like I said, discuss care needs and look at, are they going to be providing us potentially a next government? Is there going to be more funding that may get us better access to care and medical needs? Now, you might get the MP talk, but I want to speak with somebody. I've emailed my MP before, and you just get like sound bites sent back to you via email. It's nothing personal. I want to speak to them on a personal level and discuss the various conditions and just the different sort of things that are going on in my head and in my body, and just get them to sort of understand what I'm wanting them to fight for as my local MP and potentially in government as well.
And that is a very good answer. And Simon, I think also just listening to you talk today, the other thing I think that you would be asking for, just going back to my notes that we spoke, was to be listened to and to have equity in terms of your mental health and your physical health, to look at you as a whole person.
Definitely.
But hopefully we'll get to that for you. Gillian, what would you say?
I'd like a conversation with the Minister for Health and Social Care and my MP. My MP, by the way, is amazing. Absolutely, really, really, really good. So I think I would like the conversation, and well, even the conversation, everyone that's on the panel to have a conversation, and just so they can hear more real life stories as to what goes on a day-to-day basis in our lives. I think that would be a start.
Yes, and I think you said, Julian, everyday life. And that's what it's all about, isn't it? Being able to get up in the morning and live your life the way that you want to, and not have feelings that some of you articulated here today. Sarah, what would your message be?
Yeah, I think a big one would be don't starve the NHS of funding, because there are good consultants out there, there are good nurses out there, but they can't keep being good consultants and nurses if they don't have the funding. And so, yeah, my big message to politicians would be that we have good healthcare professionals in the UK, but they need the funding to be able to do their jobs properly. So I think funding is a big one.
Thank you, Sarah. Something that we've been saying quite a while. But I'm going to ask you a second question, because funding is important. But the second question is, what could they do? What could they do that would make your life better?
Sorry, could you just repeat that? I think it broke up there.
Sorry. What could they do that could make your life better?
Is this MPs or
and policymakers?
Policymakers, yeah. I think introducing a kind of a new round of training for perhaps older medical professionals who haven't been trained so recently, to get them to listen carefully and consider the whole patient as a holistic person. So potentially some more training for considering a whole person approach rather than kind of breaking it up. Because I mean, I have severe asthma and chronic urticaria, which means I'm treated under two different teams. I'm treated under dermatology and respiratory. And sometimes allergy is lumped in with dermatology, and sometimes allergy is lumped in with respiratory. It depends on the area of the country. So it's very kind of disconnected. They don't kind of consider your other conditions when they treat you. So really considering that whole person approach and bringing in training to emphasize that.
Brilliant. And I agree totally with you on training, and communication is not a soft skill. And it's come across clearly from all of you today that you do not feel that you are getting the level of communication and partnership that you deserve. Aaron, what would you say to politicians and policymakers?
I think I always ask, when is it going to change in terms of how unmanageable does somebody's life have to become before kind of change is put in place? How many people have to die before somebody's going to start really looking at the systematic problems to make change? Because there doesn't seem to be any kind of preventative measures put in place. It always seems to be dealing with waiting until somebody is in absolute crisis point to then to take action. So that's definitely been apparent in my care. It's only ever dealing with the fallout, so it's kind of dragging myself along until I can't manage it at home anymore, and then spending weeks on a hospital ward, or at times being on life support, even down to trying to access financial support whilst dragging yourself along is a really impossible task. I mean, I was signed off work from June last year, and finally had to pack in work in December. I'm still not getting any financial support, and trying to is so difficult, and feels like I've had to kind of wait to get to absolute rock bottom for people to kind of notice and go, oh, hang on a minute, something's not right here, somebody's not coping. But it's only when, you know, the alarm bells start ringing that people really start helping. And I know so many people that have tried to access not just financial support but medical support, and it's almost like the criteria for meeting the requirements of being able to access support are so high that there's millions of people sort of just existing in this medical limbo and not being given any support until you absolutely trying to get support and until you hit rock bottom is impossible. I think people need to look at the requirements for need, and probably lower the bar a bit, and realize that the longer that you're left to manage symptoms that initially might be minor, the longer that you leave them, the more major they become, the more unmanageable they become. Yeah.
Aaron, you summed up the whole webinar perfectly. The end of our webinar is coming to the end, and I'm going to leave your words as our final words, because everything you say there. And I hope that you, as a team with me today, Gillian, Sarah, Aaron, and Simon, felt that you were being listened to. And I hope that you saw the outpouring of love and support that's in the chat box. We will send those to you so you have them. People are talking about your bravery, your honesty, how they hope that things will be different for you going forward. And as a patient association, I will keep telling your story as much as I possibly can do to try and get that change for you and for others living, like you say, are in that just all be able to get on. Thank you so much for sharing your stories. Thank you to everyone else. I'm sorry we had some Zoom issues today, but I think they settled down a little bit better. And I'm going to leave it there as people say goodbye, and thank you for being such amazing advocates